Hey there, I'm Dr. Jim Collins. My topic today is one that I've become increasingly drawn to and interested in, and it involves neurodegenerative disorders. I've been on a tour all over the state talking about many of the neurodegenerative disorders, which include Alzheimer's disease, Parkinson's and Huntington's disease, multiple sclerosis, ALS or Lou Gehrig's disease, MS, and even HIV. Many people forget that that too is a neurodegenerative disorder. And sometimes, specifically, what I'm addressing that I would like to address now is neurodegenerative disorders and end of life care. End of life care is something that needs to be addressed. There should be some planning involved because the end of any neurodegenerative disorder, unfortunately, is death. Okay? So let me get into a little bit of information here, but I did write a lengthier article that I do invite you to read. It's very good. Neurodegenerative disorders are chronic. They're incurable, unfortunately, and they're progressive. And they ultimately lead in the death of the individual. It's very, very sad. Each disease, whether it's Alzheimer's, Parkinson's, Huntington's, or ALS, will present very specific challenges for the individual diagnosed with the disorder, for the family, and for caregivers, especially towards the end of life. Things can get very, very difficult and challenging. Such challenges include the variability of disease progression. You know, how fast is it going to progress or how slow is it going to take? The physical decline, the cognitive decline, management of symptoms, especially pain, tends to be a symptom that really does need a lot of attention. And as these diseases progress, one thing to always remember is that the patient, the individual, I hate to use the word patient, but you know what I mean by it, the individual suffering from this disorder loses the ability to fully and accurately communicate. So caregivers have to really pay attention for signs and symptoms of pain, discomfort, or distress. Now, all of these neurological disorders share a common pathological cause, which is neuronal loss. Neuronal loss. And this can be caused by a number of different things, like neurovascular changes taking place in the body, changes in the blood-brain barrier permeability, and cerebrovascular fluid flow, as well as neurotoxic substances. And there is another link between all of these neurodegenerative disorders, too. They run in families. There is a genetic predisposition. One other very sad thing that runs through all of these neurodegenerative disorders is the long goodbye. The long goodbye. People are going to live for a while. The disease is going to chip away at the individual's identity, their autonomy, their independence, and one of the most important things, their quality of life. So, as I said earlier, I wrote an article. There's a lot more information. I just wanted to briefly talk about this topic, neurodegenerative disorders and end-of-life care. Please go to my website, Dr. Jim Collins, where I have some really good information. I think you're going to enjoy it. And then you can check out to see what I'm doing lately. Take care. I'm Dr. Jim. I'll talk to you soon.